My name's Alison Highfield. I'm a staff nurse on Ward 40. I've worked in the NHS for over 20 years. I've worked on several wards throughout the trust and I've been on Ward 40 for quite a few years at the moment. I find this ward very rewarding, very challenging at times. I feel as though we've got an excellent team, not only with the nursing staff and with the HCAs and the other members, but also with the consultants and the doctors. We all work together, we all value each other, and I feel really privileged to be on this ward.
Hello, my name's Jane Ashley. I work on Ward 40. I'm a newly qualified nurse. I love working on here because I like working with the elderly patients. This ward is very supportive, especially for newly qualified nurses. We all mix in and work as a team, even if you're on different teams.
Hello, my name's Alice. I'm the physiotherapist on Ward 40.
And I'm Rachel, I'm the occupational therapist.
So we started on the ward a couple of months ago. We're both newly qualified. We've obviously been put onto an elderly care ward, which is quite heavily discharge based. So Rachel and I work really quite closely to plan discharges and get everybody out as safely, as quickly and as appropriately as possible.
Yeah, so I think just in terms of kind of what it's like to work on Ward 40, it is quite a fast-paced ward and things can change quite rapidly, so I think that you've got to be able to be quite responsive to the needs of the ward. But I think kind of as a team on 40 we all sort of pull together, the nursing team, medical team and sort of other allied health professions and things like that are all really helpful, and we sort of, you know, we all work together as kind of a close-knit team to make sure that people get the best treatment and care possible whilst they're on the ward. And I think we all work quite well together.
Yeah, it's one of the nicest things about this ward is how, and I've been on other wards as well before, like on placement, and one of the nicest things about this ward is how, like, there's no separation between any of the professions or anything like that. We're all really good friends in and out of work as well, which is great, and it makes for a really good and strong work environment for us all, I think.
Yeah, there's kind of no hierarchy, so I think if you've got a question then you
Yeah.
you don't really
Everyone
need to
backs
hesitate
each
to
other.
ask.
Yeah.
And, yeah,
So it's really good. And we love our patients.
and we do. We love our patients.
My name's Amy Lofthouse and I'm a HCA here on Ward 40 in North Tees Hospital. I really enjoy working on this ward because it's got a really good team dynamic. The teamwork is phenomenal and I've always loved working with elderly patients, which is what this ward is, elderly acute care. I've worked in a care home before coming on here and I just love it. You always learn something new. There's always something to do. There's always help around if you need it. And it's just a really good team, a really good ward to work on.
Hi, my name's Alison. I'm the ward clerk on Ward 40. I haven't been with the NHS for very long, only a couple of months, but my mum actually worked on this ward as a HCA previous to me, but retired due to ill health. And I'm just really proud that I'm now part of that family, continuing all that really good work that they've been putting in to move forward.
My name's Grace. I'm a third-year student nurse here on Ward 40. My experience on this ward's been amazing. I've learnt loads of new skills. I've learnt the multidisciplinary side of things and how we can discharge a patient home safely. I've actually got 2 months left until I qualify, and being on this ward's prepared me for when I finally become a registered nurse.
Hello, I'm Debbie Lake. I've worked in elderly care for 14 years. It's a very rewarding job. It does have its challenges. We have a wide variety of illnesses on here with dementia, Parkinson's and all the usual elderly problems that we do have. It's rewarding when we do get patients that come in who are really quite poorly and we manage to get them better and either send them back home, or if you're not able to go home, they go somewhere where can be looked after. And also as well, the downside is it can be quite challenging with the dementia and things, but we do what we can, and sometimes we do have some patients who are enhanced care. We are a good team on here. We all work well together, and we do get other multidisciplinary team members in to obviously to help them in obviously all other areas. So it's a holistic approach.
My name's Yvonne Vincent. I'm a healthcare assistant. I've worked in the elderly for 34 years. It's quite challenging, but you can you treat patients like you would treat your own family, how you would want them treated. And it's a good teaching ward because you get all the different illnesses, and you can teach basic nursing care.
I feel we work very well not only as a team but with other members that are needed to care for these patients, such as the therapy team, the medical team, the dietitians, and most importantly enhanced care. It's been a real honour to be part of the accreditation, and hopefully we'll do very well in it.